Wisconsin Congressman Paul Ryan. Congressman Ryan, thanks so much for being here.
Hey, thanks for having me, Megyn.
All right, so what do you make of those numbers, that according to this particular study, that the taxes are going to go up for middle-class Americans and the benefits are going to go down? Is this a partisan thing?
No, it's the Joint Committee on Taxation, which is the nonpartisan arbiter of the facts here in Capitol Hill. They've told us, I saw it myself in their testimony, people in the middle class are going to get tax increases.
You know, obviously this is something that Republicans will use to argue against health care reform as it's been styled by the Democrats. But here we are now, 8 days away from what the president says is the deadline, March 18th, for the House to pass this Senate bill, to get this thing done once and for all. How do you plan to stop it?
They are down on votes right now. I just left the floor for a vote, and what we understand is they're down about 10 votes. They're still trying to muscle votes through by making promises to members and getting them, for one reason or another, to vote for this bill. And what we're finding is so amazing is the rhetoric that is being used to sell this legislation has nothing to do with the substance in it. It's $500 billion of tax increases that hit just about everybody. Everybody. A new mandate on insurance that if you don't follow it, you pay new taxes. So tax increases, massive Medicare cuts to pay for new entitlements. And if you take a look at a real scoring of this bill, it creates huge deficits. And that's what the president's own chief actuary is telling us it does. So we're seeing rhetoric over here and substance over there, and they're far apart from one another. They don't have the votes right now. They're trying to muscle the votes. And this week and next week will be the determining times to determine whether this bill passes or not.
When you say that you believe they're down about 10 votes, who are you referring to in general? I mean, is it the Stupak anti-abortion coalition, or is it another group?
It's part Stupak anti-abortion coalition. It's part blue dogs who are worried about the fiscal effects of this bill. And then there are some people who just don't like the Senate bill because it's not liberal enough. We think they'll get those progressives, but it's really Stupak because this bill does fund abortion, and that cannot be fixed in reconciliation no matter what kind of promises House Democrats make to one another. The Senate has made it very, very clear you cannot protect that Stupak language in the Senate. Therefore, if the Senate bill goes into law, it's law. And it finances abortions. And so that is 12 people right there that they lose.
If you had to handicap it now, here we are on Wednesday. It's next Thursday by which President Obama wants a vote in the House. And the White House, even when Democratic leaders pushed back and said, look, don't put deadlines on us. We don't know if we can do it by then. The White House stood firm and said, we said March 18th. The president wants this done before his trip abroad. If you had to handicap it now, what do you think is going to happen?
I think it's 50-50. The reason I say that is look at the cap and trade bill last year. They were down 24 votes the night before. At 3 in the morning, they brought a 400-page amendment with all this pork and giveaways, and they won by 8. So the speaker, she has proven herself very able at muscling votes, changing opinions, jamming things through. So you can never count her out. But the American people are watching this bill like none other. And I really believe that they're in deficit now. We'll see if they can make up the difference because time is of the essence. If they let their members go home for this April recess for 2 weeks to listen to their constituents, the Democrats know they're going to lose support, not gain it.
But, you know, we saw that happen already. You know, we saw the members of Congress go home last August and the town hall meetings take place and the people came out and, you know, made their position clear. And the polls, you know, have shown that the majority of Americans don't like this particular bill. They may like the components of it individually, but they don't like the overall bill. And yet still, the Democrats are resolved to get this through, or at least the leadership is. Why?
That's right. It's about ideology, Megyn. This is really not a debate about health care policy. If this is about getting insurance to the uninsured, helping people with pre-existing conditions, bringing costs down, we could have a bipartisan agreement tomorrow. We've offered the president dozens of ideas on how to accomplish this in a bipartisan way. It's really more about ideology. They simply believe the government should control the health care sector. It's consistent with their ideology. They'll never have the kind of power in Washington that they have right now, again. So they're going to jam it through while they can.
But let me challenge you on that because they say that's just not fair. They say, look, this is what it's about. It's about lowering premiums for people, expanding coverage to more Americans, protecting people from losing their coverage, making sure that they can get coverage despite pre-existing conditions, all things that the American public likes when they hear it pulled out like that. They just don't necessarily like the broad umbrella of the bill. So, you know, your response to their accusation that you are not worried about those things.
No, obviously, we've put out ideas that accomplish those goals. This bill does not accomplish those goals. This bill, using arbitrary statistics, using nonpartisan statistics, real-world views, healthcare costs go up, the deficit goes up, premiums go up, taxes go up. So the substance in this legislation doesn't even actually accomplish what they claim it accomplishes. And so we're saying, why are you trying to jam this thing through? The American people don't want. We will work with you on these issues to do something that fixes these problems, yet they insist on jamming this thing through, making their members walk the plank on this issue that's extremely unpopular. And so the only conclusion I am left to make that this is more about ideology and government philosophy than it is about these individual health care policy items.
All eyes are on the blue dog Democrats in the House, including Stupak and others, which is where it stands right now and will stand for the next 8 days. Congressman Paul Ryan, it's a pleasure having you on America Live. Thanks so much for being here with us.
Congratulations on your new show.
Thank you very much. I appreciate that. Well, folks, we are watching here live pictures